Okay, hi everyone, Thomas Weimbs here. I'm here with Dr. Josh Lipschutz. And I've known Josh for a long, long time. We actually were researchers, postdoctoral researchers in Keith Mostov lab at UCSF a long, long time ago, seems ages ago. So now we're at the ASN Kidney Week conference, and Josh just stopped by the booth here. Hello, Josh.
Yeah, hi. I'm a nephrologist and the chief of nephrology at the Medical University of South Carolina. And I'll just talk about a poster we presented yesterday that we're pretty excited about. We had shown previously that there's a long-acting beta agonist called formoterol, and it sped the recovery from acute kidney injury. And we wanted in mouse models, and we wanted to see if the chronic kidney mouse models also had a similar effect. So we looked at diabetic mouse models, both type 1 diabetes when you destroy the islet cells with streptozotocin, as well as a high-fat diet, which leads to type 2 diabetes. And what we found, it was a 12-week run-up, and then 14 days of the formoterol. We gave it IP intraperitoneally, and surprisingly, it not only at all different levels, functionally looking at creatinine, histologically, looking at the slides of the kidney, ultrastructurally looking at by EM, and the foot process effacement, all this got reversed, even the fibrosis, which typically they think can't get reversed. And so we did a big retrospective study in veterans, and we looked at 25,000 patients with stage 4 CKD, chronic kidney disease, and compared the COPD patients, which chronic obstructive pulmonary disease, who take these beta agonists, and they progress much more slowly, 30% more slowly than did the patients without COPD. Presumably, our hypothesis is it's due to the effect of the beta agonists that they take. We then looked at a larger group, 200,000 patients with stage 3 CKD to advance to stage 4 CKD, and again found a very highly statistically significant effect, a little less at 11% instead of the 30%, but still diabetes is the most common cause of kidney disease, so it potentially has a big application, and we're working on setting up a clinical trial now. So.
Wow, Josh, that actually sounds really incredible. So you said 200,000 patients you looked at their records?
Yeah, the VA has a very nice system. It's called Vinci, and you can do retrospective studies relatively easily. It's a great resource. The VA also they're doing 1 million veteran genome-wide screening sequencing. So they're going to have a lot of that's linked to the records. So they're going to have a lot of really good data, I think, coming out of the VA.
Wow, we got to talk to see what we can do to collaborate.
VA system, yeah.
Well, that's amazing. Okay, so I think that sounds like a great example of bench to bedside type of work, where you take something from mice all the way into a huge number of humans in a retrospective analysis, and now you're doing a prospective study. Did I hear that right?
Setting one up, yeah. So hopefully it'll get funded. We're waiting a little for that. So.
Well, thank you so much, Josh. So you're in South Carolina, right?
Yeah.
So if anybody out there happens to be in South Carolina and has kidney problems, I know someone who I would highly recommend to check out and go to. How many patients, do you have? Kidney patients do you see usually?
So we're a pretty big center. We actually did 410 kidney transplants last year, which is the 4th largest in the country. So we have a bunch of regional hospital affiliations as well lately. We were just chosen to be a Center of Excellence by the PKD Foundation, so PKD patients especially come see us.
Okay, wonderful. Well, that's what we are all about, PKD. That's congratulations that you're the Center of Excellence. If anyone has any questions, feel free to reach out to us, and we'll forward you over to Josh. Well, thank you so much for stopping by, Josh.
Thank you, Thomas.